Hey guys, it's Dr. Kamel. I'm here to talk to you guys today about how to use an ultrasound to identify the sesamoid apparatus. Now, we recognize that the sesamoid apparatus has its purpose in functional gait biomechanics, such as in the case of hallux limitus, trauma, overuse, and in particular sports such as football, soccer, and even running or tennis. Now, when it comes to injury and pathology of the sesamoid apparatus, it's helpful to think about it in 4 different categories. Acute, such as with an avulsion fracture; chronic, as in the cases with repetitive stresses or chronic sesamoiditis, or anything that's affecting the medial or the lateral support structures of the sesamoid. And now, I'm going to show you guys how you can use an ultrasound in your clinic to make that diagnosis. Alright, now I'm going to show you guys how you can use an ultrasound to identify the sesamoid apparatus as well as any pathologies. So, patient is in the supine position, which is great for accessing the sesamoid apparatus. I'm going to take the probe and I'm going to orient it first in the axial position. So it's going to be perpendicular to the long part of the foot. I'm going to place it right over the metatarsal heads here. So I'm going to go right over the first, and right away here you're going to see, as you scan, you're going to start to see those sesamoids come into view. And what's great about the ultrasound imaging is that you can use this as a dynamic imaging modality. So you can see, as I'm dorsiflexing here, I can see that the sesamoids are coming into view and coming out of view. And right in between these sesamoids, if I can hear, you'll see the FHL tendon running right in between them. Let me see if I can point to it for you guys. So if I hold this probe right there, you can see the sesamoids and the FHL running right in between. Okay, now if we do this in the long axis view, you're going to see one sesamoid at a time. So right away there, you see one sesamoid. You see the FHL tendon running right there, and then the other sesamoid. So let's see if I can do this again. So sesamoid, sesamoid, FHL tendon, other sesamoid, or the fibular sesamoid. That's it. Alright, so here you can see in this longitudinal axis view of the fibular sesamoid, you can see the curvilinear fashion of the cortex of the sesamoid, and bone is highly dense tissue, so therefore it will readily reflect echoes of an ultrasound and give you that hyperechoic appearance. Sometimes in the longitudinal axis view you can see the FHL running depending on where you have the probe placed, but here you can see the fibular sesamoid is intact. Alright, now we're looking at the axial view of the sesamoid apparatus, and this is the money shot in my appearance. This is a great shot to visualize all the structures of the apparatus. You can see the lateral sesamoid, which is labeled as LS, the medial sesamoid, which is labeled as MS, and the star, which indicates the flexor hallucis longus, and the M, which represents the metatarsal. And you can see that these are normal and intact. Let's take a look at this longitudinal axis view of the medial or tibial sesamoid, and you can see that there is a break in the cortex, which indicates a tibiosesamoid fracture. Be aware that if this was visualized in the short axis view, you may miss this break due to the position and orientation of the fracture. So it is always helpful to be able to utilize both the longitudinal and the short axis views to gain a better perspective of the pathology. The red indicates where the break in the cortex may be visualized. Thank you guys for watching. Hope you learned something. Until next time.